Remdesivir category, antiviral status in India, approved. What it does, speeds recovery by shutting down viral replication in the body. Hospitalized patients given remdesivir were discharged within 11 days on average, compared to 15 days for patients on standard care. When should it be used? Given to hospitalized patients on oxygen with moderate COVID-19 mode of delivery, Intrave, nously in acute. Gilead Sciences working on an inhaler. GLUCOCORTICOIDS category, corticosteroid status in India, approved. What it does, calms acute inflammatory response to slow disease progression by preventing the body from pumping out inflammatory chemicals. When should it be used? For severely ill patients with progressive deterioration of oxygenation indicators, rapid worsening of imaging, and cytokine storm mode of delivery, intravenous HYDROXYCHLOROQUINE category, anti-malaria status in India, approved. Compartments inside cells that some viruses co-opt to enter cells and cause infection. Unprotected exposure to infection, people with mild disease at start of infection. It is not approved for severely ill patients. What it does, found to inhibit the activity of SARS-CoV-2 in lab studies by decreasing the acidity in endosomes, which are. When should it be used? Prophylaxis for high-risk close contacts, health workers and frontline workers who have had mode of delivery, oral tablets. Convalescent plasma category, plasma therapy. When should it be used? For patients with moderate disease whose oxygen requirement is progressively increasing despite the use of steroids. Status in India, approved for restricted use. What it does, infection-fighting antibodies from the blood of recovered people given to ill patients to boost their immunity. Mode of delivery, transfusion to tocilizumab category, monoclonal antibody status in India, approved. What it does, calms the aberrant hyperimmune response called cytokine storm by acting against inflammatory chemicals to fight infection. When should it be used? Moderate to severe disease. Mode of delivery, intravenous drip. Dexamethasone category, corticosteroid status in India, not approved for COVID-19, approved to treat rheumatoid arthritis, allergies. What it does, modulates immune-mediated lung injury and slows progression to respiratory failure and death. It cut the risk of death by a third for patients on ventilators. For those on oxygen, it cut deaths by a fifth. When should it be used? Given to severely ill patients on invasive ventilation or oxygenation. It does not help with mild or moderate disease. Mode of delivery, intravenous in acute, as tablet for less seriously ill patients. Favipiravir category, antiviral status in India, approved. What it does, this broad-spectrum antiviral works by selectively inhibiting RNA polymerase, which is needed for the replication of SARS-CoV-2 inside the human body to cause severe disease. When should it be used? For mild to moderate disease. Mode of delivery, oral tablet.
This is a COVID isolation center and hospital with 10% of its facility being catering to oxygen related patients. We will have oxygen for 10% of patients, and facility is for isolation. That means all COVID positive patients will be here for isolation. We are starting with 2,000 beds in another 2 days from now, and by first week of July we should be ready with the functioning of 10,000 beds. As per one projection, it is said that by the first week of July we might need another 15,000 beds. So we are working in that direction. We are hoping that we don't need them, but we still have to provision for them so that patients can be isolated from the community and the spread can be contained. So this is a step in that direction itself. We are hoping that we are able to cater to maximum population of Delhi which is affected. Also we are hoping that we take maximum care of patients by referring them to tertiary healthcare as and when needed on emergency basis. And we have had a provision of that also in this facility. So we hope to reduce